And welcome to this week's Vets I Recommend, sponsored by the Spaw and the Spodcast. I'm Carrie Hyde, I'm your host, and we are going to be bringing on a very fabulous veterinarian here in a few minutes. And I wanted to tell you how unbelievably I am excited about being able to bring this to you. Because my goal is to help you raise healthier animals. And it's kind of a little selfish reason because I am so tired of seeing sick animals. Like I'm trying to be as kind as I can about it, but I see sick animals every day and my heart is overwhelmed with the pain and the suffering that I'm seeing. And why I get so frustrated is because I think most of it is preventable. And it's preventable in ways that you may not have control over because you need to get healthy mothers to have healthy puppies. And so it goes on and on and on. So our next guest that's going to be coming on, the next veterinarian that's going to be coming on, I wanted to share a story with you while she's getting ready to come on. She was the very first, when I did the podcast, when I started my podcast, which we changed the name. It was all, I don't even remember the original name, but then we changed it to the Spodcast in honor of the Spaw, because that's how I got away from traditional, I don't want to say away from traditional veterinarian care as a vet tech. It's just that it's where I was able to kind of branch out a little bit on my own. I still believe in a lot of traditional things. Obviously, I'm not 100% non-traditional. It's just that I know that to set your pet up for success, you really need to have everything in place. And when one little thing is tweaked, it can be a problem. So I started this podcast. And when I first started, I thought, oh my gosh, how am I going to get guests? Who is going to come on? Nobody knows me. I'm not Ellen DeGeneres. No one's going to come on my show, if that's what you want to call it. So I was very stressed and I started reaching out. How am I going to get guests? And the very first veterinarian that agreed to come on the show is our next guest. And so I haven't I haven't spoken to her in a while, but she flew all the way out to California to come sit in the studio that I had aligned out in LA. And she just educated me so much. And then by virtue of that, she was able to educate all of you. And so if you listen to the very first episode, season 1, first episode, you're going to get to hear our next guest, which is Dr. Margot Roman, who's going to be coming on here very soon. She just won. You guys have no idea what a treat this is for you. So I hope you're going to not be so shy and have your questions going and everything that you need to go. So she just won Best Veterinarian, the Holistic Veterinarian of the Year. She is not local for those of you who are following us in the Orange County area, but she is in the kind of Boston, Massachusetts area. And so, but she can do consultations for you. She is an expert on all things that is holistic with your animals. And I am just so excited. You're going to learn so much from her. I'm going to learn so much from her. I already have some questions that people have emailed me, which is something I wanted to let you know. If you ever can't come on here and see the podcast going, the live going, you can always email me your questions, or you can, you can ask me, you can send them to me. You can put them on our Facebook page before we start. And then I can ask the questions when we come on, which is I'm going to be doing a little bit tonight. Remember that your questions are so helpful to other people. And especially if you're not a shy person. Sometimes we get people who are, afraid. They think the question's going to be stupid, and so they don't ask the questions. But then somebody asks the first question and you would be surprised. I cannot stress enough to you all pet animal lovers. People are always very surprised when I say, oh yeah, that's common. And they cannot believe it. Like, oh, you have other dogs that other dogs that have diabetes? Oh yeah, diabetes skyrocketing. So what feels like it's just your pet, because we can't believe that some of these human diseases that we're seeing in people and we hear about in people are so common with our animals. So please don't be afraid to ask questions. You're going to be shocked when you hear how much we are seeing these diseases in animals, which is one of the things that Dr. Roman and I had talked about way back when we first did the first podcast, is the difference. She and I both have been in working with animals for very many years. And look at who is here. I'm so excited. I was just talking you up. I'm trying to tell everybody how excited I am to have you, and how lucky they are to have you be, able to come on and talk with us. How are you? This is Dr. Margot Roman, everybody.
Hi, thank you very much. And I can't believe it's been so many years ago that I was out there. I mean, COVID just seems like I don't know, years just passed by, so many years. And it's great to see you again and help you do this thing, because it is so important for people to know what they can do for these animals that they love, that are part of their family. And so, when my practice is still running, and I'm looking for a veterinarian. Anyone who wants to come to Boston who has a holistic heart, please get in touch with me. It's difficult because there's so many sick animals that are so much sicker than they were 25 years ago, and definitely 45 years ago, because I've been practicing that long.
Yeah.
And such chronic disease in young animals that we never saw before. And I sadly feel that the veterinary profession is not accomplishing what they're set out to do, which is to have animals free of disease and live to 15, 16, 18 years of age, and without cancer, without autoimmune disease. And it's just not happening. And it's very sad. And I think people are, I don't know if you saw the Holistic Pet Summit that was just on with, I don't know if you watched that, but that was really on the whole crisis that's going on, right now. It really needs to be, people just need to be conscious about it, because the animals are the canaries in the coal mine, and they're showing us, how terrible the sickness is. And if they're aging 7 times faster, what we're going to see is the same thing in humans in the next 10 years. So we've got to open our eyes and just stop poisoning our environment and poisoning our country. And of course, now we may end up poisoning everything if we get into a very, violent war with big, with nuclear stuff and whatever. But that's so far out, but it could be very not far out. But it's just really scary right now that we need to, have people pay attention to, what the animals are doing, because they are telling us what is going to be our problem. And it's really sad.
It is. It's really sad. And right before you came on, I was saying how both of us have been around long enough to know that this is changing. This is not, some of these diseases that we're seeing. Back when I was a vet tech, which now is 21 years, we really didn't see diabetes. We didn't see Cushing's. We didn't see a lot of these autoimmune diseases, all of this stuff that is happening, but people are convinced it's just maybe their dog. And I'm trying to explain to them that this is an epidemic. And, when I tell people, someone will come to me and say, "Oh, have you ever heard of a dog's liver enzymes being elevated?" Are you kidding me? Every day.
I mean, and the thing is, we've got more diagnostic tools. So obviously, veterinarians are able to diagnose things more easily. So that's a good thing. But sadly, they don't know how to go back to how to take care of the animal's own immune system, and trying to encourage that to take care of the animal. So, what can we do as as caretakers to these animals that live in our lives, and I'll call them pets, even though they're more than pets. But how do we take care of them so that they don't get sick, and we don't have to spend a fortune at a veterinary hospital every 6 weeks or all the time, and these animals are suffering.
Yeah.
So I want to give you 2 of cases that just have happened in my practice that are still. I mean, I have miracles that happen every few days, and I just go, "Oh my God, that is why I still practice. That's why I have to keep doing this," because I see the animals that a lot of them, that they haven't been able to have success in conventional medicine. And often when they come to me, it's so wound up with so many drugs and so many procedures and so much stuff that I got to unwind it all and find out where I can start this animal in the clean direction so that it can actually heal. So I can talk about two cases if you want me to
Oh
talk about.
yeah, no, I am such a lover of, I think the stories are what help us learn and educate people, and understanding what makes us so passionate about holistic is the cases that we see, and we see it happen. But before we do, I want to talk about one of the downsides, right, of being a holistic veterinarian is often times the pet comes to you because all of this has failed. And when all of it has failed, and by the time they come to, or I send somebody to a holistic veterinarian, oftentimes the dog is very old and it's hard. And that's where I think it's really hard for a holistic veterinarian. We want to see them as puppies so that you never have to do that. But then when they do finally come to us, so I really want to speak to people who have these puppies right now, these younger generations. And you're such a great person to talk about this, because I want to talk about your poodles. I want to talk about,
I love talking about my poodles.
I do. I want to talk about your poodles because I sometimes, it used to be, and I know that you'll probably agree with this, and if you don't, that's okay too. But it used to be that I would see dogs around the age of 2 years old get sick. It used to be, I would say, oh, I would look at their history of their diet and their vaccines and all this stuff they've been on, and I would say to myself, oh, by 2, this dog's going to be sick. But now I'm seeing them 4 or 5 months already problems.
Oh,
And
that's so.
so don't you think that goes back to the mothers, which is why I want to talk about your poodles and how you raise them?
Mm-hmm. Well, every vaccine that we give has an impact on the immune system. Every deworming that we give has an impact on the immune system. And every pesticide that we put on our dog has an immune system effect. And you're talking generation after generation after generation after generation. And each generation could be a year, 2 years. So in 20 years, there could be 10 generations or even more than that, right? And if that animal was on antibiotic, if the great, 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 great grandmother 25 years ago was on antibiotics, she lost her microbiome that she never gave to her daughter, who never gave to her daughter, who never gave to her daughter, who never gave to her son. So it just got lost along the way. And so my standard poodles, I've been raising them now for 30 years. And as a holistic doctor, I was like, I'm going to not treat them with antibiotics. I'm going to treat them with acupuncture or with herbs or with homeopathy. So my dogs are almost 30 years, never have had antibiotics for 6 generations.
Wow.
So they've passed a natural birthing to the next generation, and their microbiome is so amazing that that's the two cases I want to talk about, is the combination of what we did for these 2 dogs that literally are miracles. And I really want to say it's the microbiome. And if any of you have, Google microbiome or Google fecal transplants, there is so much literature now on the gut-brain connection, on the gut-heart connection, on the gut-bladder connection, on the gut. There are all these things that I saw 10 years ago when we started doing this, but I could not prove it to anybody. But now researchers are saying of course there is. You've got a vagus nerve that has to communicate with the brain, and the microbes communicate with parts of the vagus nerve, go to the brain, and then affects these other organs. And it's crucial that these animals not be poisoned by multiple dewormings as puppies. They get 4 or 5, 6 dewormings sometimes. They get 8 or 9, 12, 20 vaccines before they're 6 months old or 8 months old.
It's crazy.
It is so unhealthy. And I think that veterinarians have to understand that if you can establish antibodies in a puppy, why would you keep giving it a vaccine?
Yeah.
That is not a good thing. It's not one is good and 6 are better. No, one is good. And if one is good enough, that is where you stay.
Yeah.
So my personal puppies, and I'll tell you where they are. So they are 6 generations, have only had 1 plain distemper and 1 plain parvo for 6 generations. Have only and didn't get any more. And my great great grandmother died at 15 and had antibodies for distemper and parvo that were protective. So the dogs I have now are the grandmother now is just turning 8 next month, and her daughter is 4.5, and then her puppies they're 6 months old. And we did on these puppies, we gave them the first distemper, I mean, a parvo shot on at 12 weeks and 1 day. Okay. And then we gave a distemper shot 2 weeks later. We did titers on them 6 weeks later, and they were 1 to 400.
Oh.
Why would I give a series of vaccines? I did isolate my puppies. They're not, and get someone asked the question, do you get the rabies shot? Yes, I gave my rabies shot. I usually don't rabies vaccinate my dogs till they're 6 months old. I vaccinated them at about almost 5 months old, 4 months and 2.5 weeks old, because I had coyotes running through my yard. And I thought, that's just what I need, is these puppies going, oh, who is that, to visit, and get into a scrapple, and then I have to put them in isolation. So I do not vaccinate them until all their incisors are in wear, meaning their top and front and back ones are in wear. And I just kept them, made sure they didn't get out to see any of that stuff, and vaccinated them because I felt like I had to do that. But the other puppies that are in my litter that went to their other homes are not going to get vaccinated till 6 months, because they don't live in the woods here. But I wanted to make sure that they had antibodies to protect them if they got exposed. So it's very, I give the rabies shots, and then I titer them if I pull titers on the adults today, and to see because their rabies vaccines are ready to expire, and I want to see where their antibodies are. And if their antibodies are really high, I am going to see if, because they're donors, and I don't want to give them anything more, to just make sure that we are watching their antibody titers fairly closely. So if you have an antibody titer, that should be as valid as just throwing a vaccine into their immune system that you don't even know if they have an immune response to. So if I can document a high antibody titer, that should be the standard of care.
It should be the standard of care. Absolutely. It's shocking to me that it's not the standard of care, but we keep pushing and we keep pushing, and hopefully it will be. Can you tell the story about when you were, I don't know if you remember this, but when you were going to, I think it was orientation for veterinary school, and they told you were going to have to get titers, and how you came about this idea that, wait a second, I'm going to let you tell the story, but it's so fascinating how you came to the idea that maybe we shouldn't be getting all these rabies vaccines.
Right. So in 1974, when I got accepted into veterinary school, the first week we had orientation, and we needed to get rabies vaccinated, because in Alabama they had rabies. I was at vet school in Tuskegee, and we had rabies in the area, right? So we all had to get vaccinated for rabies. And they had an assembly, and they said in our assembly, get yourself titered every other year, and only when your titer drops, get a booster. Under no circumstances, just get boosters every 2 or 3 years, because you can cause an autoimmune reaction in yourself. So that's what I was told when we got the vaccines. And so every other year I have had a titer done on myself, and not I'm due now, but the year before last I had a titer done, and it was protective, and I've never had a booster. So you're talking 40, let's see, where are we now? 48 years, that it's crazy that 48 years I have still retained my antibody titer. And what do we do with these dogs? Oh, just give them another vaccine. Oh, give them another vaccine. Give them. It's just, I think, irresponsible.
Irresponsible.
It's irresponsible to say, just give them another one. Doesn't matter. Doesn't matter. I have a friend who lives in India, where rabies is very bad, right? It's a deadly disease, and it's a terrible disease. And we're talking about, something that is not really treatable with conventional medicine, really. And so, it is a bad disease. And she came to visit me, and they make her get a rabies vaccine every year in India, every year. And I said, do you know about titers? She said, no, they never told us about titers, because the titers are expensive, and the vaccines probably cost them $20. So if they have to do a titer for $300, or a vaccine for 20, I mean, why would you tell somebody to do a titer? But these poor veterinarians are getting vaccinated every year or every other year, and that's ridiculous.
It should be an option, I mean, that's one thing I don't like so much about veterinary, is they just assume that people aren't going to do it. They just assume that people will think it's too inconvenient. They just assume it's too expensive, but it should always be this is the best thing to do. And then
Mhm.
we can work back from there, because of
Mhm.
course price and things can come into play for people. Absolutely. Completely understand that. But it's not fair to just not put it on the table, because as we know, there's a lot more money to be made in vaccinating constantly and just giving them the vaccines and sending them along their way. Plus, rabies is transmitted from dog to human. So there's some fear there, I'm sure.
Oh, well, yeah, there is. And it is a really bad disease. I mean, I
Sure.
wouldn't wish it on any animal or any human.
Yeah.
If you can establish antibodies, that's the whole concept of vaccines, is how do you establish an antibody level that shows protection? If
Yeah.
you give a vaccine to an animal, and a vaccine only has to, with rabies, has to be 86% effective for licensing. So that could mean that 14% of the dogs out there never got an immune response from the vaccine, but it's still licensed. So if I have a piece of paper
Good
that says
point.
my dog had a rabies vaccine and never had a titer, how do I know it's not in that 14% that
Right.
may not have responded? Who
Well,
knows? I mean, I would rather know my dog's number than just have a piece of paper.
sure. I just had a veterinarian that I was speaking with, and the dog was, I think, moving to Hawaii. I'm pretty sure it was Hawaii. Had to
Mhm.
get the health certificate. They
And
had to show proof of the titer and the rabies vaccine.
exactly.
But here was what was interesting. She had given that dog a rabies vaccine like a year prior. So they ran the titer, no antibodies, zero, nothing. And so
Wow.
she's like, here we are. We're pumping these animals through with this stuff, and we're sending them out there, saying that the reason we're doing that is to protect the public, right? In
Right.
case rabies. But yet we've probably, like you're saying, 14% of our animals are running around, without even protection, and they just got their little piece of paper.
Right.
So on so many
It is,
levels,
oh, it's really, when I've tried to approach my state veterinarian, I don't want to hear it. No,
yep,
unless it
yep,
comes out from the USDA, don't talk to me about it. I said, but here's science. I don't want to hear it.
nope,
And
don't want to
that's
hear
the
it.
kind of response I get. And I'm like, why would I give a vaccine to a dog that has cancer?
Yeah,
Why would I give a dog a vaccine who's got autoimmune disease?
yeah,
If a dog has severe allergies, why am I giving vaccines to something that has a medical problem that is totally protected? If it's not protected, then we need to figure that out. And how do we give that vaccine as safe as possible, hopefully establish antibodies, and that we can somehow navigate through the immune response that might cause a negative side effect to that animal. But it's really challenging. And for veterinarians that think like I do, it's really hard because the boards don't want you to talk about this because it makes everybody else look irresponsible, that they're
yeah,
just putting these vaccines in everybody. And it takes 3 seconds to give that vaccine, but it takes about an hour to discuss why you wouldn't do the vaccine in lieu of
exactly.
and we don't have time. People don't
Yeah,
have time to be listening to that stuff and understanding how the immune system works and studying that stuff. And I think it's really important that we do have these discussions and have, I think the responsible thing is getting a titer done, seeing if your animal has antibodies. If your dog has
absolutely.
antibodies, you've done your job,
Yeah.
you know. So anyway, so
So I want to, we're gonna get into some questions and some stuff, but I just want to tell everybody that you are probably the only person, and I'm just gonna say person, that I know who's traveled on an airplane with dog poop.
for you, right?
So let's talk a little bit about your dog's
Dog
poop.
poop. Yeah, I mean, actually, my dog's poop has been rated #1 in the world for diversity.
I'm
So
so
I
excited.
am the
That's why I want to
queen
talk
of
about it.
dog poop, huh?
That's why I want to talk about it, because
No, it's wonderful. I mean, the miracles that I see with this poop, and I'm going to do these 2 cases that I was just talking to the owner yesterday, and I said,
yeah,
"Can I
let's
use
do
your
it.
animal and use your name?" And she said, "Sure, go for it." So, I wanna tell you, the microbiome is 80% of your immune system, okay? And if you can get a healthy microbiome from animals that have had their guts respected for 30 years and generational and not put stuff in there to kill it and food that would kill it, like anything with glyphosate or Roundup or genetically modified stuff. And you protected it just because I wanted to make sure I could get poodles that I could clear out cancer and clear out autoimmune disease and Addison's and and seizures and all these things that a lot of these breeds that breed has, and thought I gotta go dig back into time and get rid of it. And according to Richard Pitcairn, who I've studied with for many years. He said it takes at least 3 generations and 4 generations to get rid of the miasms. So my thought is I'm going to try to peel off all the negative and get to some really clean dogs. So now we're at the 6th generation, and the puppies are magnificent. And even I took her to a trainer, and she said, who's been training for 45 years, and she said, I haven't seen a litter like this in 30 years. So they're mentally there. The dogs are just not balanced. They're all over the place. And so she just was blown away by them. She couldn't believe them. So, but the point of this is that their microbiome, we are here to share it and to give it to other dogs. And we are now, we are sending it to 2 different companies. Animal Biome, which is in San Francisco, is utilizing our microbiome. Right now, it's only for veterinarians to purchase for their patients. Once there's enough inventory, they can offer it directly to the consumer. And then the other company we're working with is Novel Biome, based out of Canada. And they're doing a different way of freeze drying. They're each doing freeze drying. We do at our practice fresh frozen, and we're going to be probably going into some form of freeze drying as well. Just because we're with these extra puppies that I have, we now have enough poop to share more poop to share the shit.
I'm such a child. I can't help it. I just giggle every time.
Anyway, no, it's amazing. But
Poop to share.
Poop to share. Yeah, that's a good name. We can do it. But it really is something that is dogs have been self-medicating, right? They've been eating poop all the time for years, and they're inoculating themselves with a diverse microbiome, and they can't do that anymore. And I wouldn't want my dogs eating some other dog's poop, because it's probably toxic in there, because they're getting pesticides, they're getting, it's spot-ons or heartworm preventative that, or flea products orally and all that stuff, which is terrible. Is really terrible. So, but by doing the microbiome and restoring the gut's diversity, there's so many benefits to just getting even a young dog and giving them the puppy poop from our puppies. So they know that the original scaffolding that occurs in the microbiome is initiated by the vaginal birth of a baby. And that if babies don't get that bifidus infantile, they don't build off of it. You have to have this beginning to build your foundation, and then this bacteria gets onto this and this and this.
Right.
Never got that. You have nothing to start with. So we've started incorporating using the puppy poop and giving that to sort of set up the scaffolding, and then start adding the adult poop to it. And that is working really well. It's really exciting. So, our puppies are now, they're almost 6 months now. So they are, I think I'll consider them puppies probably till 9 months. So we've got about 2 or 3 more months of puppy poop.
I want one so bad. You have no idea. But my husband adopted 3 kittens. So I currently have my 2 dogs and 3 kittens, and plus my cat down at the spa. And so I'm like, gosh, but I so badly, one of these days I'm going to get one of your puppies, and, cause I want to be able to donate the poop and do all of the stuff. And, I just want to be a part of that.
Who has one of my puppies now, who's out there, is Audra McCorkle, who's in.
Oh, really?
Yeah. So she got her name. Well, the puppies were all named because they're plant-based dogs.
Yeah,
so it's raised plant-based. So we have parsley, papaya, apple, blueberry, quinoa, chia, and what am I missing? Apple. I got apple. I'm missing one of them. But anyway, and cilantro. Forgot cilantro. The cilantro. So cilantro just got his new home, and he'll be working with Dr. Jerry Bukoff in New Jersey. He's opening up a huge holistic practice with about 4 or 5 vets in New Jersey, and he's going to be having separate fecal transplant section where he's going to bring the animals in and do all the fecal transplants there. And then Audra McCorkle, she's doing him and her little dog, she changed the name to Eve. So Eve is doing there already. And then Blueberry, who's up in Ashland, Oregon, is working with Terry Sue Wright, and they're doing live fecal transplants up there already with him. So we're trying to have places where people can do the live transfers in real time. And then they can still ship from us and do mixology and get the different diverse microbiomes that these puppies may not have continued to get because they're not living in my environment, like totally.
The first time, so Dr. Roman had flown out poop out here to California on a plane in an ice chest for my dog. And I put it in the backyard, assuming she would eat it. I don't know why I thought she would just eat it. She's not really a poop eater. I think she has a pretty healthy biome. She's a raw fed dog. She's actually gone half plant-based now. She's doing, yeah. So both my dogs actually now are eating a lot more vegetarian. I did a podcast with Dr. Pitcairn, and we talked a lot about what's going on with all of the toxins in our meat source. And I know, we could get real deep into that, but we won't, but because we did a podcast on it, so people can listen to that. And so I've shifted a little bit. And I do part plant-based. Like I'll do days where my dogs don't get any meat at all. They're just eating a lot of plant-based and stuff. So, but so I get the poop and I put it in the backyard and I just wait. Well, she just didn't do anything with it. So I thought, I'm going to have to, so I had to put a glove on and I actually, and I thought, oh my God, what is happening? I'm stuffing poop down my dog's mouth. But when it was so satisfying because I just envisioned all the little bacteria getting into her gut and the good bacteria, the healthy stuff that we want. After it was done and she ate it, I don't know why I was so satisfied. Dog poop.
Well, but I'll tell you. So I want to tell you about these two cases.
Yes, let's hear this.
This is a red standard poodle that was born in Washington State, was flown out to Boston at 6 months, and came off the plane with diarrhea. Okay, so they thought, it's anxiety, diarrhea, the poor thing, right? So they took it to their vet and they put it on metronidazole and they put it on some other drugs and they did a giardia, and they found like a possible giardia. They did more metronidazole, they did Tylenol, they did all these drugs. They went to 2 different veterinarians prior to going to Angel Memorial Animal Hospital. Angel Memorial Animal Hospital, they saw 5 different veterinarians, and they went from this drug to that drug to this drug. And the owner happens to have a biotech company, and she knew about fecal transplants. So she asked Angel, can we get a fecal transplant? And they said, yes, no, we do them here. So the dog was having diarrhea 6 to 8 times a day, 5 times during the night. So every hour and a half, they had to let the dog out to have the squirts all over the yard, right? Wow. So they had the first fecal transplant, and for about 5 weeks, it only had 6 to 8 times a day, and it could hold it through the night. So they thought, oh my God, they have 5 hours of sleep they could have instead of every hour, And so and then it came back with a vengeance and was 5 times a night again. They did a second fecal transplant there, and they got no improvement at all. Still had 5 times at night, 6 to 8 times a day. Basically, they said that they don't know what else to do with this dog. They've tried everything. They're going to do intestinal exploratory, whatever they were going to do, but they couldn't get it. So she, on her own, found my practice. And I said to her, if I can straighten your dog out, will you let me take this case and present it back to Angel and talk to her? She said, absolutely. If you can solve this dog's problem. We did ozone, UVBI with a hemolumin, fecal transplant, and vitamins. The next day had normal stools, and it's 9 weeks and has normal stools every day.
From one treatment
of treatments with ozone and the fecal transplant. Angel uses their dogs who are eating Hill's diet, probably not a generational protected microbiome. They're not seeing anything. They don't want to do them because they don't see anything. And they put them under general anesthesia with endoscopy and implant it up there and put them on, and they don't see anything. So we do it standing, dog standing. We do ozone. We give them the rectal ozone, and it works. And it so successfully works. I mean, this dog, we can give more details about this dog, but she sent me pictures of the first bowel movement. It looks like a woman going up to the stars with a cloud. I'm like, oh, that's so cool, But it is so sad, they're thrilled that they have this. They have a dog that is not 6 to 8 times a day having diarrhea, and normal stools. So that was that case, and the dog still had a little bit of nausea. So I told them not to buy the capsules, just to buy the raw little nuggets, and they gave 1 day of that, and the vomiting stopped. So the gut microbiome in the stomach needed to have its own inoculation, to
Yeah.
help settle that down, because the capsules weren't opening until later into the small intestines.
Yeah.
So that was a cool case. And then the one that was from this last week, 2 weeks ago, well, it's the last week and a half I've been treating it. This was a Roddy who was 1 year and 2 months old. Gorgeous, beautiful, beautiful dog. He got hit by a car and it broke his back. And it went to Tufts, and 3 doctors tried to convince her just to euthanize the dog, because the dog's not going to have bladder tone, possibly not going to, if they do the surgery. It's just such a bad injury, right? And so she went for the surgery, and the dog is in a diaper because it has incontinence of stool and it's mostly diarrhea. And she has to express its bladder 3 to 5 times a day. And she does it sometimes with a catheter and sometimes manually expresses this male dog's urine. And so the dog came in, and he was walking, but he was sort of dragging his feet, and he could only walk a short period of time, like, like an eighth of a mile or whatever, could just, barely, he could just get himself to go poop, and he would just drip stool as he was going, and he couldn't pass urine. So I took him, they had him on 2 or 3 different antibiotics for bladder infections because he had chronic UTI. And the only antibiotic that they had a sensitivity to was chloramphenicol, which has been taken off the market because it causes a severe, it can cause anemia, and it can cause liver issues and kidney issues. It's not a healthy antibiotic. You don't even want to touch it, right? So this dog is on this very strong antibiotic. She's got little kids at home that are hugging and kissing the dog, and it's on this really strong antibiotic. So we took it off the antibiotic the night before I saw it, came in, and we flushed the bladder. I did ozone and acupuncture and the aquapuncture with the hemolumin, which is a UVA, UVC, amber, blue, and green light, and flushed the bladder with ozone. We did it a second time and did acupuncture, on the back. And when I put the needle through the acupuncture, it literally felt like I was going through beef jerky. Normally, like, we'd put a needle and it's like going through steak. I had to like almost like drill it in. It wouldn't even go in. The muscle was so contracted and so inflamed. And so on the 5th day, the dog started wagging its tail. Hadn't wagged its tail since the accident, right?
Wow.
Did a fecal transplant after that. The dog started having normal stools and regaining some of his anal tone and having been able to control it.
Yeah.
Next, 2 days later, the dog had urinated on its own.
Oh my gosh.
So I saw him yesterday, and that was 2 weeks. He was out of the diapers, right? She walked him 2 miles the day before.
That's crazy.
That is, to me, crazy.
Crazy. It's crazy. It's
crazy.
It's just so sad to me that when I say people, I'm talking about other veterinarians, other veterinarian schools that are not listening. I know you shared a story with me a while back about ozone and pyometra, and on a golden retriever. And you're the biggest reason why. Now, I'm not a veterinarian, everybody knows that, but I learned a lot about ozone from you. And I do a lot of ozone baths now. And just oh my gosh, the difference in these dogs' skin after 2 baths. I did one yesterday, or did one the other day, and the lady yesterday told me after 1 bath, she can't believe the difference in the skin.
Yeah. And I mean, it's an amazing tool. And I feel so grateful. I mean, and it's sort of like, I'm being, I would never have learned ozone if I hadn't had my horse and had to suffer through the treatment that the veterinary school treated me and told me my horse should be dead. And I said, no, I'm not going to kill my horse. And he lived years, getting ozone treatments and jumping horse shows. And that's why I learned ozone, is to take care of my own horse.
Yeah.
I would have never learned ozone. I don't think I wouldn't have been forced to learn something that wasn't hard. It just seems complicated, but it's not complicated at all.
Yeah.
It is, but it isn't. And from that, I that was in 2003, that I was trying to take care of my horse. And because of him, I've learned, almost 20 years of studying ozone around the world with some of the top MDs and physicians and, naturopaths and chiropractors and, orthopedic surgeons. And I have just pursued it and studied with these people. And then at the same time, learned from them, then moved it to the veterinary field, and then went back to them and taught them what I did in the veterinary field, because they can't do a lot of stuff that we do because
Yes.
it's all restricted by, and the insurance. The insurance won't cover it, or this or that.
Right,
So,
right.
insurance doesn't cover most of the stuff that I do. I mean, it's getting to be a little better, but some of them won't cover the ozone, and they're the insurance companies are biting their, spiting, whether that bite your nose, bite your face, whatever. They're not understanding that this could save the dog so much expense
So
and
much.
cheaper than
I
doing
know.
an amputation of a leg that you can save with ozone. So
Yeah.
I can't understand how these
I don't.
these
It's
would
difficult. I
say
had
it's experimental. It's experimental, unless they don't want to step on the toes of a lot of the veterinarians that use their product.
right.
So they don't want to step on their toes.
It's
So
difficult. I have a case right now of a dog. It breaks my heart all the time because they bring him in constantly for baths, but they want me to use the chlorhexidine every time. Chlorhexidine, chlorhexidine, chlorhexidine. Then they're getting frustrated thinking I'm doing what they asked me to do. I give my
yeah,
opinion,
but I
but
guess they need to realize that you need the microbiome on the skin.
I
The
know.
microbiome is taking care of the body, and the ozone will kill the microbiome, but then floods it with oxygen.
Yep.
So it allows the new stuff to come in. One of the things that we're doing now is our biofilm water. So my dogs, 30 years, 6 generations, have never had one piece of plaque, one piece of tartar, one cracked tooth, one gingivitis. I have never brushed my dog's teeth, ever, or my cat's.
And what are
And
you using? What are you doing?
nothing.
No, I
So
mean,
no, what it is that in studying with biological dentists and restorative dentists, it's your biofilm in your mouth that causes your caries, causes your plaque, and causes your tartar and gingivitis. So if you have not a balanced bacteria in your mouth, then you are going to get tartar, plaque, and cavities. If your biome is balanced in your mouth, then you're not going to get it. So what I do is we've been, my dog's backwash. We sell my dog's water bowl backwash at the clinic, and you inoculate your bowl, and you get it's like my dogs are sharing your dog's bowl, their bowl with you, but I'm not going to let my dogs share their bowl with you. So I'm harvesting them water 2 or 3 times a week, and then people take a teaspoon of my dog's bacteria, take their stainless steel bowl or their glass bowl, pour boiling hot water into it to kill the biofilm that's in there, put fresh spring water, and then put a teaspoon of my stuff in there and let that stuff grow the slime on the wall, right? Instead of your dog's slime on the wall. And so then when they drink, they're hopefully inoculating themselves with my dog's backwash.
can we get that somewhere, or is it only?
Well, right now it's only through my clinic, and
Yeah.
we have lots of it, but it's something that we have at the clinic, and I don't want to. I think there's too much that's live in there to start mass processing and freeze drying
Right.
it. I think it
Right.
needs to be a live thing, because that's
Yeah.
really what it is, right? So, and anyway, I mean, now they sell a lot of probiotics for the mouth, but they're 3, 4 species. There
Yeah.
are a trillion microbes in your mouth, and each
Right.
section of the mouth has a different colony.
It's
So
so
who knows
unique.
what's in there? It's so amazing.
Yeah.
So I had a dog. We've been doing it now for over 3 years now. And I had a dog who had cancer, who had liver cancer, had terrible teeth, had a heart murmur, and everybody said, put him down. He's just really in tough shape, and his teeth are so bad. And I had her get ozonated oil to put on the gums, give the dog a bone to really sort of gnaw and help break it off, and put that biofilm water, and it cleaned its teeth off. And it lived like 9 more months when
That's
it was 12,
amazing.
2 or 3 days. And its mouth got cleaned up. I mean, I think, having a filthy mouth like that is not good for your immune system. That is not good health, to have that dysbiosis in your mouth that causes all this plaque and tartar in your mouth.
Yeah, and then they're just swallowing more of it. It's just messing everything up. I just want to take a quick moment to say hi to a couple people. Jan and Lisa are in the room. I think there's a few people. We're in a couple of different places, but Jan Livingston wants to know how she can get one of your puppies, if this is something that you do.
Well,
Tell us a little bit.
I might have one puppy that might be available. I don't know. I was raising a puppy from my granddaughter, who we found out was handicapped a year ago yesterday. So this was the main reason I bred the dog, was to develop one for her, and I've been training her, and I don't know if it's going to work out. So I might have one other puppy, but we have I'm very strict on who would get this puppy. The last person who got the puppy is like, she checked every box in my box, and they have to be plant-based. They have to be raised holistically. They have to be kept away from toxic chemicals and because I've worked 30 years to protect this microbiome. So I'm so careful, and they have to be contributing to saving other animals by connecting to several holistic practices that would be utilizing their microbiome. So
Yeah.
that's where I don't know where Jan lives. What part of the country does she live in?
I'm not sure. I'm not sure. I've seen her on a couple of things, but maybe
Mhm.
Jan, you can let us know where you are, and you can certainly reach out. We have all of Dr. Roman's information there. Dr. Roman, I'm going to ask you a question that was sent to me. I'm going to read it. It was emailed to me by somebody who couldn't make it tonight, but she wants to watch this on the replay. So she has a little dachshund named Lando, and he was diagnosed with, and she knows you can't, do anything, but it's just a couple questions. So just a little backstory. He was diagnosed with a liver shunt. And also his copper, he's storing copper too much.
Okay.
So she knows that she's seen several vets, and maybe she could do a consultation with you where you can get a hold of more. But on a side note, she's considering changing the diet. She wants to know if there's anything like one thing maybe that you would add to the diet to help the liver shunt, if there's something that you think she
I
can do.
think I don't know any cases that I've done that are just like that, so I can't really say
Right.
from my experience this is what I would do. Again, I think that giving oxidative therapies like ozone is wonderful. Giving them nutritional, anything that has a liver in that is not working efficiently, to do what we do to help the liver work as efficiently, and whether it be milk thistle and the hoxie and all of that. But I think the microbiome. I think if you can get the microbiome of a healthy puppy into that dog and have it have more diversity so that it can break down the protein the way it should be, and the animals just can't. They're deficient because so
Right.
many times they come in and they've already had vomiting or diarrhea, and somebody's already putting them on Cerenia and before they diagnosed a liver shunt.
Yeah.
You usually don't jump and say, "Oh, you got a liver shunt." You try first some, deworming or something. Everybody tries some stuff first before they, go to the zebra. Instead of they think of horses first before you think liver shunts are just not that common.
Yeah.
So I think going with a holistic vet and figuring out where you can strengthen the whatever liver function is there is how I would address it. But I've never had a case like that, so I can't say, oh, in my experience, I've seen this. So
She's
it's
struggling because she's out here in Orange County, and this is one of the kittens, by the way.
oh, very cute.
Surprised she made an appearance. I bottle fed. So interesting. I tell people, so I do bottle feeding for the animal shelter here, and they have some restrictions on what I can and cannot do. But feeding wise, they don't really care. So these guys went straight onto raw goat's milk from day one. They didn't have any powdered anything, nothing,
Yeah,
none of
that's
that.
better.
Yeah, I didn't do that powdered junk food. And the kittens that I take in are so much healthier than when I first started doing it many years ago. I did the powdered junk stuff.
Right.
And then as soon as they'd open their eyes, they'd have upper respiratory infections and you name it. They were just sick as sick. And then you have to go back to the veterinarian, get all of the drops and the this and the that. But once I started on the raw goat's milk, it's just amazing what diet can do. So let's talk a little bit about pancreatitis. So why do you think that particular one? Because I've seen that across the board. I've seen dogs with mostly kibble fed, to be honest with you. Most kibble fed dogs are the one. It's interesting to me that veterinarians want to take them all off of and not put them on a species appropriate diet or anything. But pancreatitis is one that I think is the biggest epidemic. Why do you think that is it?
Microbiome. I
Microbiome.
take those animals and I give them fecal transplants, and they don't get pancreatitis very often at all.
Really?
Ozone works for pancreatitis. It works amazing for pancreatitis. We don't have a treatment for pancreatitis in conventional medicine.
No, they're just throwing stuff at these.
It's not, it's an inflammation. So throwing antibiotic and an inflammation when you don't know what it is malpractice, I think.
Yeah.
You don't know what it is. It's an inflammation. You do something that is anti-inflammatory, like oxygen. If you throw it, according to the AVMA in August 2020, unless you know exactly what you're treating with an antibiotic, you're not allowed to do it anymore, because there are 700,000 people a year that die from antibiotic resistance in the world every year. Every year. That's the same number of people that died from January to September from COVID in the world in 2020. So 700,000 people every year die from resistance to antibiotics. So if we are, as veterinarians or as indiscriminate physicians or as farmers, are putting antibiotics in because we just think it'll make the animal, we don't know what we're doing, but we're just going to give it anyway, right?
Every day I see that.
You cannot do it anymore.
Yeah.
And veterinarians that do it, but they do it because there's no other tool they have to
Yeah.
bring down inflammation. I do rectal ozone, we do UVBI, and we give them a fecal transplant, and they are so much better the next day. So much better the next day.
Can you explain what ozone is? A lot of people are confused. Like, what is ozone?
So ozone is a modality in which you use oxygen, and it's 97% oxygen and 3%, maybe a little less than that, of O3, which is a very transient oxygen molecule. When that molecule hits the body temperature, it super releases more oxygen into the tissue, but it causes a reaction within the body that increases oxygen levels into the mitochondria. So simply, it's just increasing your oxygen level in your body and causing this oxidative stress that happens. But then your body, it's like it's preconditioning your body to something that would need more oxygen. So your body, when it gets it reacts in a way that is more balancing to yourself. So using ozone for viruses, for bacterial infections, should be the first thing people use before they grab an antibiotic or an NSAID. Giving ozone and prolozone over the back or in the joints instead of doing steroids and surgeries. Why can't you have ozone injected into a joint versus a steroid into your joint or in your back or wherever? I mean, and it works, because I have a family member who has a bad back and has had a disc, since she was 12, and had prolozone, which worked great. But then she went for ozone therapy directly through guided fluoroscopy right into her disc. And that was 2 years and 1 month ago. And she's been sound since then.
It's amazing. And you can buy an ozone machine if you wanted to do that to your dog or yourself, for that matter, right? Like, it's legal to buy.
Yeah, you could buy the machine, and there are on my website are 3 companies, and you can go on their websites and read all their information, and they're not hard to use. I mean, it's a little, scary because you have an oxygen tank, but people that use welding equipment have oxygen tanks, right?
Right.
It's not like it's a propane tank. A propane tank's way more dangerous, and people throw those in the back of their car, and go to the exchange, that blue Rhino, and they throw the thing and they take one out, and it's not like, I mean, propane will blow up your house. Oxygen, wouldn't do that. So, and you're not having
a class at all on how to do ozone on your own dogs?
I mean, I have on my website a course that I taught through the American Academy of Ozone Therapy about 4 years ago, and it's still up there. And I've offered it to veterinarians, and now, and I guess people can take that class, but you can't be doing it on other animals. You do it on your own animal, because it's your own animal and your own body. But there are a lot of information on the websites of the companies that sell the ozone generators. O3 Vets puts together a summit, which I was part of, and it was like 2 weeks ago. And they have those recordings. They have an introductory class too that they have, I think, online too as well. I was going to put together a course, and I just have been, too busy trying to keep out of the, from trying to get my clinic. So to do I'd like to teach a course for pet owners how to do ozone therapy.
I think it would be
save them so much grief and money, and having a way to treat ears or treat, infected toe, or to support your animal's digestive system. It's so many wonderful things. But what I really want is people that have pets to encourage their vets to look into something that would be so positive for their practice, that it's not a huge learning curve.
Right.
Veterinarians, taking acupuncture courses or herbal courses or homeopathic courses or chiropractic, it's a learning curve. They have to study and take exams and take, do cases and all that kind of stuff. Where ozone is really, it's an application of using the ozonated saline or using the ozone gas or using in procedures that they do anyway. So it's just adding that piece into something that they're already doing.
I
So it
think
makes it
that's
so much easier.
I think that's probably one of the biggest barriers for veterinarians and for people. I don't just in general change, learning something new. These things are big barriers, and veterinary medicine, in my opinion, holistic veterinary medicine is still, I feel, in its infancy as far as getting more people and learning and getting them on board with it. It's very difficult to get people to try something different and change. I'm guilty of that. I've been doing what
I
I've been
think
doing.
everybody is. Yeah, no, everybody is. You get into your comfort zone,
Yeah.
and you don't have time to learn something else. And I get a lot of veterinarians calling me because they want the veterinarians want this. I mean, the client wants to have a consult with a holistic vet, and I talk to vets, and a lot of them are like, I don't have time. I
Yep.
don't have time to do it. But what I'm saying to them is, if you don't have time to learn it, know it exists,
Yeah.
so that you can say to somebody, I don't know anything about acupuncture, or I don't know anything about homeopathy. I don't know anything about ozone. I don't know anything about microbiome, but I want my patient to get the best care that they want to get.
Yeah.
And so I'm not going to say there's nothing else you can do when you don't know any of this stuff. That's the part that really eggs me, is just how, you can say there's nothing else you can do.
Yeah.
And people say, well, what else can I do? I can't. They just put them to sleep. And that makes me like crazy, because it's like, do you know anything about ozone? Do you know anything about this or that or the no, you
Well, yeah,
know?
think back all the way back. I don't see it so much anymore, but I remember, and I know you do too, back when Cocker Spaniels, mostly Cocker Spaniels at the time for me, their ears would get so inflamed and infected, and they would just keep throwing antibiotics at it. It wouldn't work. Then the scar tissue, and then eventually they would just sew up the ear
Right.
because they didn't know anything else to do. And so they sewed up the ear completely, permanently. And it
And
was,
it's still drained. It's
yeah,
still
it was just
out of that skin,
it was just horrible to think that, just because somebody doesn't know doesn't mean that there's not. And I wish doctors, veterinarians, anybody, if you don't know, just say you don't. Maybe there's something
I
out
don't
there.
know,
I'm
and
not
not
aware of it.
right, exactly. So to say there's nothing you can do because you can't think of anything else to do,
Yeah. Yeah.
to say I can't think of anything else you can do, not there's nothing else you can do. But if you say to the person, there's nothing else you can do, and you don't know any of these modalities, then I think you're depriving that owner of care. And
Yeah.
most of the insurance cover a lot of these other things. And so if they're saying that they can't get those things because they don't know where they are, that's a sad thing. The
Yeah. It
veterinarian needs
is.
to be a little more open to looking at the American Holistic Veterinary Medical Association, the AVH, the IVIS. All these listings have these veterinarians that are able to do some of these other things for their patients and collaborate with them. Don't, just tell a person to euthanize it,
Yeah.
just collaborate.
I think that's what's so great about holistic veterinarians. I feel like the holistic veterinarian world is much more open to collaborating with each other and learning new and did this worked and sharing stories and doing those kind of things. So, Lisa, we're going to ask this question real quick. I don't want to keep you too long. We're coming up on an hour, but Lisa says, what do you think about, oh, I'm sorry. It's cut off on mine.
Adequate injections.
Oh, I can't even see it. Adequate injections.
If you don't have immediate access to microbiome, is there anything you can use daily to balance some of the mouth? Well, there are the probiotics. VetraScience makes one. It's an oral microbiome. There's a company called Teef, TEEF. They make a microbiome, but they're like a probiotic. They're small amounts of species, but that's better than nothing.
Yeah.
Eating them, raw diet. I mean, using ozonated oil in the mouth, which you can get ozonated oil from any of those companies that are, there's ozonated oils, .com, there's PromoLife, there's O3 Vets. So on my website are some of those listed there. But using ozone on the mouth gets rid of the biofilm, and then feeding them, healthy foods and fresh foods would be great. So,
Yeah. So you can do consultations though, right? Like if somebody wanted to.
Well, if I would love to work with a veterinarian, but it is hard sometimes. If I could work with a holistic veterinarian, that makes it so much easier because I can. We're speaking a similar language. I
Sure.
just had a case recently where the veterinarian wanted to do this, but she had no idea what anything I did. So I spent an hour with the owner, 40 minutes with the client, and then another 30 minutes together, and we still didn't get anywhere. And I thought, I have to charge them for this. I can't just
Right.
I would love to give it for free to everything, but I have to pay for like 9 staff people. So if I'm on the phone for 2 hours, everybody's waiting for me. It's a little scary for me to not charge for that. So I do charge for consults now,
Good.
but I
Well, I
would
mean,
prefer
I think you should.
it'd be prefer to have a holistic vet so that I can just summarize it and they go, oh yeah, I got all that. Boom. Whereas, do you use glandulars? No. Do you know acupuncture? No. Do you have access to ozone? No. Do you have, like I ask it's like, let's find somebody who at least has the elementary components of that treatment in their hands, and then we can move from there.
Okay. Okay. So I'm gonna let you. It's been coming up on an hour. I don't want to keep you too
Okay.
long. Is there any last things you want? I know we can't stress enough about this microbiome. How do you I know you kind of alluded to it a little bit, but once you are restoring the microbiome, if you were doing the transplants or however you're going to restore it, how do you maintain it?
Well, organic food, fresh food. I mean, if you start giving your dogs processed food that is full of chemicals for preservatives and with glyphosate, which is Roundup, how the Roundup kills your microbiome. So, glyphosate, which is ubiquitous in the food chain, kills our microbiome. So, if your dog is not getting fresh organic food, it may that is organic, it may be killing off what you put in there. So we have some dogs that have to stay on. I have two dogs in well, maybe three, but two dogs in my practice that have to have poop every day. So they get a capsule every day, and that maintains their life. But before they came to me, they spent $40,000 each, trying to maintain their guts,
Yeah.
and they were having hemorrhagic gastroenteritis and terrible diarrhea all the time and indigestion. And both of them said the poop is the cheapest thing and one of them has insurance, and the insurance covers it all.
Oh, wow. That's good that the
Yeah,
insurance is covering it.
the other
I
one doesn't.
honestly think that's why, because I do rescue, I work with a lot of
Mhm.
shelters and stuff. I honestly believe that one of the reasons we have so many animals in the shelter is because of how sick these animals are. People can't afford it. $40,000 and the animals still got diarrhea. Not everybody can do that, and they just give up and then they just take them down to the animal shelter, which is why I do stuff like this to try to set these animals up better for
Mhm.
success. Jan wants to know if you have any recipes that would help her if she
Yeah,
decided she
I'm trying
wanted to.
to. Yeah, I mean, I have on my website on the blogs, it's like what I feed my dogs, but I've changed that a little bit, and I'd love to have what I would love to do, and I actually tried to find today because it's there's a holiday of Purim, and there's a company that was making what homotashim, which are these little triangular cookies, and they're raising money for Ukraine, but they were delivering it. The guy delivering it, I was talking to him, and trying to find people locally to start making the type of food that I make for my dog to try to do more plant based, because it's we can't do it anymore in our environment. It's too our earth is too much climate change, too much. It's not sustainable. It's
Right.
inhumane. To
Right.
kill 8,000 animals for one dog's life is not fair, and
Right.
it's not fair to the earth.
Uh,
So yeah, so I have a recipe that I'm doing. If I could find people that wanted to start preparing it and selling it and doing it, I would love that. I mean,
yeah.
it would be great to do that.
I know that the company Green Juju does a lot. That's what I use for
Good.
my dogs. It's a lot of plant-based, the whole thing. And Jan, it's easy for me just because I'm so busy at work. And so it's a little bit more convenient. But Green Juju has all sorts of, now they're not considered balanced. They don't sell them as a balanced meal, but it certainly can start you in the right track because it's
Yeah.
got
I
a
mean,
lot.
is it all organic? Do you know? I
Yeah.
don't know if it
Yeah.
is. Good.
Yeah.
Okay.
So
Wonderful.
a lot
Wonderful.
of organic, a lot of everything in there. I mean, there's so much in there. And also I know that Dr. Pitcairn, his last book that came out, I think there's a couple recipes in there. because they talk a lot. His wife wrote a lot of stuff about, and she has a blog also with some recipes and stuff. So I think it's coming. I think that the progression is getting us, we're leaning towards that way. And, just trying to educate people a little bit more about what we can do as far as, being responsible and respectful of other animals. And like you said, sustainability, there's so much that there is to learn about this, and can we do it? And certainly if we can raise our animals in a healthier way and also be conscious of the earth, we should be doing it. So
I agree with you. I mean, we have to think of, all of us that love animals and feel like, we've got to feed them this meat, and we want to have kids, our kids or grandchildren or great, they won't be able to have animals. There'll be so many that are just dying from cancer, and the environment will be so toxic from climate change. We got to all work together and make this earth a healthier space for the animals and ourselves.
sure.
And it's an important. And Dr. Pitcairn's book has recipes too in there.
Yeah.
And they just put that up there. So
yeah, his last one. So his first one, which was the very first book I ever read, which set me down this path. But his the last edition that he just put out is the one that would have that.
Yeah.
Patty wants to know real quick before we let Margot, do you soak your grains before preparing them?
I soak my beans. So I do a lot of beans. So I have black beans, garbanzo beans, pinto beans, azuka beans, or whatever. And I soak them for at least 24 hours with kombu and with asafoetida, which is hing. It's a Indian garlic that stinks terribly. But you put it in there, and it supposedly helps get rid of the lectins. The grains that I usually when I'm making the quinoa, I don't soak them. I rinse them, and I rinse them well, but I don't soak them. I'm making such a volume that to rinse that volume is so hard to do, but it would be good to soak the quinoa. So I use quinoa, I use oats, I use a little teff, amaranth, all organic in the grain section.
I think that's the hard thing for people to really understand. Like, I've always been big on not feeding grains. I see a lot of grains in commercial pet foods. And what people don't understand is the grains that are used in commercial pet food is your lowest. They're not getting organic. They're not doing that. So when we're talking about staying away from grains in commercial pet foods, it's just like in kibble, right? They're using the lowest quality of stuff. So you have to be really careful. And it is important to be soaking if you're going to be, I've just been learning a lot about why the purposes of soaking stuff and removing like the lectins and that kind of thing. So it's just all kind of interesting. There's so much, and
there's so much that I don't know. And
yeah,
the more I learn, the more I know.
Yeah.
But I see the miracles of this microbiome being introduced into other animals, and the changes that happen either are just miracles, or it can't be so many of them one after the next.
Yeah.
I mean, dogs that were beet red, inflamed on Apoquel for 2 years, spent $10,000 on Apoquel, was bald and feet were swollen. We do the UVBI, ozone, and the fecal transplant, and the dog 3 days later is getting hair on its body that hasn't had hair in 2.5 years.
Yeah.
That has to be microbiome. That has to be microbiome.
I agree. The one thing I will say, and we can end on, is be patient, right? Would you agree? Like, be patient. People want, I do one ozone bath, and if it doesn't work the first time, it doesn't work. You have to be patient with the microbiome, right? We can't, although you've had some cases where the next day, right? That dog's poop next day. But that was ozone.
So the thing is, if you can get everything in there to help you work together, and you're not suppressing something, the body wants to heal. The body doesn't want to be sick. And when we give all these drugs, we're really interfering with the body's direction to try to heal itself. So, I think that's why I love the ozone therapy and the oxidative therapy of using that, or hyperbaric oxygen. But I actually think ozone is better than hyperbaric. Yeah. And I have a hyperbaric chamber, and I think it's way better.
Yeah. I think that is such a good point, what you just say right now. The body wants to heal. Yeah. It's just like if we could just remember that the body wants to heal, it wants to balance itself. We just have to allow it to do that and give it time to do that and use the right modalities. So
Mm-hmm.
Dr. Roman, thank you so much for
Oh, you're
spending the
welcome.
time, spending this hour and 10 minutes with us to help us learn a little bit more and educate us. I can't thank you enough. I'm just so excited to be talking to you again. I just, like I
I know.
said,
It's
very
great to see
first,
you again, right? It's great.
just a very, very first person to come out. I'm looking to put together, I don't want to put you on the spot so you don't have to answer, but know that I'm coming for you. I am wanting to put together a healthy pet expo out here in California because we don't have one. We
Okay.
don't have one. We Chicago, New Jersey, like they're all over, but California just doesn't have it. And so I'm looking to put one together. And of course, I will be reaching out to you. I don't want to put you on the spot
Okay.
right here.
No, I'd love to help you with that. I mean, we did the Integrative Pet Expo in Boston outside of Fitchburg when we did the HVMA convention there, and it was wonderful, and people so appreciated it, and we tandemed it with the HVMA meeting, and I had really hoped that somebody would have taken that whole concept, but they did. Other people did. We did this in 2000 and when was it? 2010, I think it was 9. Anyway, we did it years ago. And
Oh, good.
so it was really well received. And I think everyone is changing now. And there's so much available now on the internet with live streaming of these types of lectures and stuff like that. Um, people want this. They're tired of just putting more drugs into their bodies and
So
drugs into
tired of it.
and
Yeah.
it's not, and you listen to the commercials on TV and you go, why would I put that in my body when it can cause lymphoma and, you know, death?
Seizures and death. I know, and death. I know it's crazy. Well, I'm hoping we can get it together, and I'm hoping to do it every year. And I want it's going to be live. It's just we just need more, just more. If for any reason, I think sometimes when I go to these expos, it's just
Mhm.
reinforcing. It's just helpful, even if I think I know everything, which I don't. But even if I'm like, I don't want to go to that again. I always learn more. Always learn
Right.
more. Always
I mean,
learn.
I even, I learned from you guys, I mean, I learn from my clients every day. I mean, there's
Yeah.
just, their observations are invaluable. When
Yeah.
they see something, it's really fun. But, I wish more veterinarians would just be able to be more open-minded about stuff and not have been
Yeah.
indoctrinated in veterinary school to think that this kind of stuff is woo-woo and it doesn't mean anything. And it really is so important.
Yeah, I did with Dr. Richard Pitcairn. I mean, not Pitcairn, Dr. Patton, Dr. Richard Patton, who I think you know. He came out and we did a little thing on nutrition, and
Hmm.
because he's a bioscientist, and I thought I'm going to invite all the veterinarians in this area, and not one showed up. Oh no, I'm sorry, one veterinarian did show up, but most, all I sent it to probably 50 vets. So you're right. I hope that I can expand this and get it going. I think vets would be less burnout when they start healing instead of just suppressing, right? They would start
I
feeling the pleasure that you get, like how excited you're, like, I want to share these 2 stories with you. Like
Well,
they're
it
just,
does. I mean, it just it feeds my soul. I mean, that's
yeah,
why, I don't need to practice anymore. I've been practicing for years. I've been, but that's joy
yeah,
when those animals when they come in and the people are just like you see the suffering of the whole family. Especially 5 times at night that getting diarrhea squirting all over your yard. And waking up every hour and 15 minutes to get your dog outside so that it won't ruin your house.
yeah,
How, that's not as much suffering as this Rottweiler who, was in such
sure,
pain and couldn't urinate and couldn't defecate. I mean, to have that dog turn around in 8 days,
yeah.
that's not going to happen with antibiotics and
No,
NSAIDs. I'm
no,
sorry. It's
no,
not.
it's not. It feeds your soul. I hear you. Although I'm not a veterinarian, my husband always thinks it's weird that I love to bathe dogs. I love it. I love to get them in there and put the ozone bath on them and look at their skin, and it feeds my soul. It feeds my soul
Right.
to see an animal feel better. It just
Mhm.
it just really is. And to know that it's long term. It's not a band-aid. It's long term. That's why I love it so much. And that's why I love talking to you. You're just such a ray of sunshine and just so lovely to talk to. I can't wait to talk to you more about the expo that I'm going to be putting together out here. So I'll get a hold of you after this, but I'm going to let you go. If there's anything else you want to say, if there's last minute, I know I said that before, but I promise this time.
I thought Patty was on there to say hi to Patty.
Oh, hi, Patty. Yes, yes. She said she's a huge fan of you.
Anyway, but it is really important for us to have voices in the veterinary field and to speak up and to, I think, have your veterinarian understand you want the best for your animals. And so by speaking to them and having them understand, if they completely discount you, find another vet. Don't support somebody who has such a narrow mind that they can't keep their eyes open and just discount something like this. So find another vet and support them and encourage them.
That's amazing advice. And that advice can go so far. Thank you for that. That's such great advice. Lori's behind the scenes, so I always want to thank her. She's the one typing all of this for you, so you guys have access to all of the information we're talking about. So Lori, thank you so much. To all of you guys for coming on and helping make this be a collective group of ideas that we can share with each other. Thank you so much for being a part of this. This is only I just started doing the Vets I Recommend, so it's very brand new. I can't wait to see it grow. We've got veterinarians like yourself. I think in all we have 12 veterinarians that agreed to come on, and so you guys can pick a Wednesday. We send you out the calendars and they get to pick a Wednesday. So hopefully you guys will join us some more, and collectively your kitties behind your shoulder right now that I'm looking at.
Oh, yeah. Well, I'm redoing. I have a friend person helping me like tear apart my office, and
yeah,
forgot about tonight, and everything's a mess, and I'm like, and then she's gonna probably pull down everything that's there, and it'll all come crashing down right before we end.
Yeah, I took on these 3 kittens, and I thought they're not as hard as puppies. What was I thinking? These guys are into everything. It's crazy. So, anyway. I'm going to go ahead and let you go. I'll give you a call the next day or two. Is that okay?
Yeah.
Okay. All right. Bye, everybody. Thank you for joining. Take care, Dr. Margot. Dr. Roman. Sorry.
Okay. Bye-bye.
Bye.